I had bariatric surgery about 10 months ago, and so far I've lost 180 pounds. After doing tons of research before and after surgery, I've come across plenty of myths and misconceptions surrounding weight loss surgery. So in this video, I want to address the top 5 myths about bariatric surgery and give you the real story based on my personal experience and the best research I could find. I'm Joel, and you're watching Joel Gets Swole. The first myth I want to talk about is that bariatric surgery is only for people who are extremely obese. I think this idea became popular because of shows like My 600-Pound Life. And while yes, surgery can absolutely be life-saving for someone at that size, the medical guidelines are actually way more broad than that. The American Society for Metabolic and Bariatric Surgery, or the ASMBS, updated their guidelines in 2022, and they say that bariatric surgery is safe and recommended treatment for obesity for anyone with a BMI of 35 or higher. And for someone with type 2 diabetes or another obesity-related condition, that BMI number drops to 30. So let's imagine someone who's 5 feet, 8 inches tall. They would be a candidate for surgery if they weighed around 230 pounds. And if they had diabetes or high blood pressure or another comorbidity, they would be a good candidate even if they weighed as little as 200 pounds. Now, obviously, BMI is not a perfect metric, so not everyone who falls into those ranges will be a good candidate for surgery. But the broader point is that you don't need to be super morbidly obese for bariatric surgery to be a real option. Just to drive that point home, about 30 million Americans have a BMI of 30 or more, but only about 1% of them will opt to have bariatric surgery in a given year. So I think it's clear that bariatric surgery is very underutilized compared to how much the population could benefit from it. Myth number 2, bariatric surgery is the easy way out. I have 2 thoughts on this one. The first is that even if bariatric surgery was easy, why would that be a bad thing? Like if I have to build something and I use a cordless drill instead of a screwdriver, would that be the easy way out? Or if I have to go somewhere and I use a car instead of a bicycle, is that cheating in some way? Surgery is just a tool, and it's up to the person receiving surgery to determine how they're going to use that tool. Obesity is a complex chronic disease with many contributing factors. It used to be that diet and exercise were the only tools we had to combat it. But now we do have more tools. We have bariatric surgery and we have GLP-1 medications. But those things by themselves don't just magically cure obesity. They have to be used in tandem with huge lifestyle changes. And that brings me to my second point, which is that weight loss surgery in general is just not easy. Just getting cleared for surgery involves months of prep work, nutrition classes, counseling, lab tests, medical clearances, dealing with insurance, and it can even still be very expensive. It also involves a strict pre-op and post-op diet, including weeks or even months of full liquids, soft foods, and it takes a huge amount of time and money and is a massive investment. After surgery, it's a permanent lifestyle shift. Daily vitamins for life, routine lab work, and for it to be effective long-term, it requires completely changing your relationship with food and your body. Not to mention that almost anyone who has had surgery has had to go through years of trying to lose weight through traditional means like diet and exercise. So the idea that it's easy, I call BS. The third myth is that bariatric surgery is extremely unsafe or risky. This used to be true decades ago when surgeries were performed open, meaning that there were large incisions and very invasive procedures with a long recovery time. But nowadays, almost all bariatric surgeries are performed laparoscopically or even robotically, and the safety profile has completely changed. Today, bariatric surgery is as safe or safer than gallbladder removal or hip replacement. Major complications happen only about 4% of the time, and most are very treatable. Plus, every accredited bariatric center now tracks and reports outcomes to a national database, and there are even online calculators that can determine your exact risk profile and benefit profile based on individual factors like age, BMI, and other factors. There's a thing that most people forget, and that's the risk of not having surgery is often way higher. It's extremely risky to live your life morbidly obese. Long-term studies show that people who have untreated obesity have way higher risk of diabetes, high blood pressure, heart attack, stroke, sleep apnea, and even some cancers. I know for me, living life at 435 pounds, I got to the point where not having surgery felt more risky than actually having it. It's very possible that it saved my life. The fourth myth is that everyone regains all the weight they lose after surgery. It's true that some weight regain is common after surgery, or any weight loss for that matter. But let's look at the data. According to the ASMBS, on average, patients maintain about 50% of their excess weight loss even 10 to 20 years later. The Swedish obese subject study, one of the largest long-term trials, found patients were still down 25% of their total body weight after 10 years. Now, is weight regain possible? Absolutely. Studies suggest anywhere from 25 to 50% of patients will regain at least 10% of the weight they lost within 5 to 7 years. But that's not the same thing as gaining it all back. And with today's tools, follow-up programs, nutrition support, and even meds like GLP-1s, people have way more ways to keep the results going. And even a small reduction in weight that's durable can have long-term health benefits. The final myth we'll look at is that GLP-1 medications like Ozempic, Wegovy, Mounjaro, or Zepbound make surgery obsolete. It's true these medications are very powerful. They're the most effective medications we've ever had to fight obesity, and even more powerful drugs are being developed and are on the way. In the future, it's possible this myth turns out to be true, but for now, surgery still comes out on top. At the 2025 ASMBS Annual Scientific Meeting, researchers presented data comparing surgery with GLP-1s, and they found that patients who had sleeve or bypass lost about 5 times more weight at 2 years compared to those on semaglutide or tirzepatide. These are real-world results, taking into account that not everyone who gets on these GLP-1s stays on them long-term. On average, surgery leads to 60 to 77% of excess weight lost in the first year. GLP-1s can't produce those results, at least not yet. And that's the catch. When you stop taking the medication, most of the weight comes back. In the Step 1 extension trial, nearly all the weight lost on semaglutide returned within 1 year of stopping it. Surgery, on the other hand, has decades of data showing lasting results. That said, it doesn't have to be either or. These drugs can be a huge complement to surgery, helping patients either prepare beforehand to lose weight and make surgery safer, or can also help people lose more weight or manage regain after surgery. But they don't replace surgery. Bariatric surgery is still the most powerful and durable treatment we have for severe obesity. And I wanted to let you know that on the next episode of the Keeping It Off podcast, I interviewed Jordan and Danny Torres, who had bariatric surgery and started using tirzepatide to help them maintain their weight loss years after surgery. If you'd like to hear more of their story, definitely check out the next episode of Keeping It Off. You can find that here on the channel, in video form, or in audio form, wherever you get your podcasts. So those are the top 5 weight loss surgery myths busted. If you found this video helpful, make sure you hit that subscribe button so you don't miss future updates. Thank you so much for watching, and I'll see you in the next one.